everyone, welcome back to my YouTube channel Nursing with Beatrice. In today's video we'll be looking at dose calculation. For today we'll be looking at oral medications, the different forms like tablet, capsule, liquid. Now there are some important things I want you to consider. Some of these things are: one, you need to determine the form of medication. For this oral medication, is it tablet, is it capsule, is it liquid? You want to know that. Another thing, you want to know the route of administration. Is it by mouth, is it intravenous, intramuscular, subcutaneous, and all that. You also want to know the frequency. How often do they want you to give this medication? It's going to help you with the calculation. You want to also ask yourself, is there going to be a conversion? Do you need to convert from one unit to another? And then you want to check the ordered dose and check the available dose. This is going to help you when you are doing the calculation proper. Finally, after calculating, you want to review your work. I think this is the most important. You make sure you review your work to be sure that what you have gotten is the exact amount or the exact answer they are asking you to get. Now I will look at some examples. As I take one example, I'll give you opportunity to try. So question 1. The question says order 650 mg of acetaminophen PO Q6 hours PRON for pay. The supply acetaminophen 325 mg per tablet. How many tablets will you give per dose? So now let's look at the question proper. We are determining the form of medication. So this medication is going to be, according to what we are seeing here, is tablets. The next thing is, want to know the route, is by mouth, PO. Frequency, they said every 6 hours. And conversion, do we need to do any conversion? So the order is in milligram, the supply is in milligram. So we are good for that. And then we've seen the order dose, 650 mg. The available dose is 325 mg. So since there is no calculation, we'll just go straight and put it in the formula. So the formula is amount to give is equals to the ordered dose divided by the supply or the available multiplied by the quantity. Order dose is 650 mg. And since we are not doing conversion, we just put 650 mg. The available dose says 325 mg. Milligram. Multiplied by the quantity. They say per tablet, so that's 1. We'll just put 1. Don't neglect this quantity, because when you get to other questions where you are required to use, maybe they give you 5 ml, 10 ml as a quantity, or they say per this tablet and all that, you will need to insert it. So it's better you make use of the quantity now, because anything multiplied by 1 is itself, so it's not going to affect it. So always make sure you put this one so that you get used to it. So let's calculate this. If we look at this, so milligram cross milligram, so 325 divided by 650, that will give us 2. And the question says how many tablets, so we'll be given 2 tablets. So I'm giving you this question, you try this. Order Wellbutrin 150 mg PO BID, that's twice a day. The supply is Wellbutrin 50 mg. How many tablets will you give? So if you do this calculation very well, the answer you will be getting will be 3 tablets. Let's look at example 2. Order 0.2 gram PO Q6 hours PRN. The supply for that particular medication is 50 mg per capsule. How many capsules will you give? Let's see, analyze it. So the form of medication for this one is capsule. The route is still saying PO by mouth. The frequency says every 6 hours. And want to look, do we need a conversion? So this is in grams, this is in milligrams. So yes, we will need a conversion for this. And the order dose is 0.2 gram. The available dose is 50 mg. So let's put the question in. So first of all, we're going to do conversion. We know that 1000 milligram will give us 1 gram. Now the question says 0.2 gram. So I usually do proportion. So 0.2 gram, so that it will be gram on the same line. So we're looking for this particular medication, 0.2 gram in milligram. So we are saying X milligram. Next thing we're going to do is to do what we say cross multiply. So when we cross multiply, so we have S, we're looking for S in milligram multiplied by 1 in gram equals to 1000 milligram. So we now have X C in milligram equals 1000 milligram multiplied by 0.2 gram will give us 200 milligram. So wherever we see 0.2 gram in this question, we will be putting 200 milligrams so that milligram can cancel milligram. So now let's put it into the formula. Remember the formula again. Amount or dose to give equals to ordered divided by available or supply times quantity. Very important, always include this quantity. So the ordered now, instead of 0.2 gram, we'll be taking 200, replacing it with 200 milligram because we've done conversion. The available, from the question, it says 50 milligram. We'll be putting 50 milligram multiplied by the quantity. Now let's determine the quantity. It says 50 milligram per capsule, so it's 1. Still, so we'll put 1. Now if we do this, milligram cancel milligram, 50 in 200, so the amount or the dose to give will equal 4. Remember to always put the unit, so it's in capsule, we'll say 4 capsules. So that's what we'll be giving this patient, 4 capsules. So I'll give you another one to try. Order 500 microgram PO daily. The medication is supplied as 0.25 milligram per capsule. How many doses will you give? So if you do this one very well, the answer will be 2 capsules. So let's look at question 3. Order 0.5 gram of amoxicillin PO Q12 hours. Supply 250 milligram per 5 ml of amoxicillin. How many ml will you administer? So let's analyze it. The form of medication. So if we look at this one, is liquid form, because we are saying ml. The route of administration is saying PO. The frequency says Q12 hours. And then do we need to do conversion? So this is in gram, the other dose. The supply is in milligrams, so definitely we'll be doing conversion. Other dose is 0.5 gram, available dose is 250 milligram. We'll start with doing conversion. So 0.5 gram, we're going to convert the gram to milligram so that it will be the same. So remember again the formula, we have 1000 milligram will give us 1 gram. Using proportion again or ratio, so 0.5 gram, we'll leave the gram this here, 0.5 gram. That's gram. We're looking for the answer in milligram. S milligram. So we cross multiply. S milligram times 1 equals to 1000 milligram times gram. S, which is in milligram, will be 0.5 gram multiplied by 1000. That will give us 500 milligram. So meaning S is now 500 milligram. And that means anywhere we see 0.5 gram, we'll replace with 500 milligram. So the formula again, amount to be given equals to the ordered dose divided by the available or the supply times the quantity. The other dose now will be 500 milligram, no longer 0.5 gram because we've converted. The available dose from here says 250 milligram. So we have 250 milligram. The quantity If you look here, it says 250 milligram per 5 ml. So the 5 ml is the quantity. So times 5 ml. Now milligram is going to cancel milligram. 250 divided by 500. So here we have 2. 2 times 5, we'll be having 10 ml. So now you try this. Order 750 milligram PO 6 hours for 7 days. And the supply is 250 milligram per 5 ml. So if you did this correctly, the answer will be 15 ml. That will be the answer. So that wraps up today's topic on dose calculation, part 1. I'll be doing a part 2 where I'll be looking at IV, IM, and subcutaneous medication. If you enjoyed this topic, please like, share, and subscribe for more educational content. Thanks for watching.